Welcome to Derm Clarity, Poor Decisions and Flake News, the podcast where we talk about dermatology in a way that actually makes sense, without the medical jargon, and with just enough humor to keep it real. I'm your host, Erica Ramos, a dermatology physician assistant with over 20 years in medicine. I've worked in family medicine, emergency medicine, rheumatology, and dermatology, which means I've seen skin from a window to a warning sign and what happens inside your body and on our skin. For most of my career, I've stayed firmly in the lane of traditional medicine. I believed in evidence, guidelines, prescriptions, and honestly, I was skeptical of anything labeled holistic or functional. I didn't want to practice what everybody called quackery. I wanted science. But here's the thing. When I really look back, integrative medicine has been around me this entire time. Early in family medicine, I worked with a doctor who did prolotherapy and
Yeah.
acupuncture. In rheumatology, we used platelet-rich plasma and regenerative injections. And now in dermatology, I do the same thing for scalp health and skin rejuvenation, helping the body heal itself rather than just masking symptoms. And our patients are changing. They're asking better questions. They want to understand their skin, their immune system, their inflammation, not just what cream to put on it. Even in my own life, I see the shift. My son has epilepsy, and while medication is necessary, he wants to avoid unnecessary treatments whenever possible. He wants clarity. He wants options. Today's guest is someone who has seen this shift coming long before it became trendy. She's a dermatology PA of over 25 years and the voice behind Whisper Medicine. Early in her career, one patient, newly diagnosed with lupus, asked a simple question, but a powerful question. What can I do with my diet to change the course of my disease? That moment, combined with her own daughter's health journey, changed how she practiced medicine forever. Today, we're talking about functional medicine, immune health, skin disease, and how to balance science with the whole person without losing your credibility or your common sense. So let's get into it. Kerry, welcome to Derm Clarity. I've been listening to your very first podcast, and honestly, it feels like you were asking these questions long before the rest of us were ready to hear them.
Erica, thank you so much for that amazing introduction. So many things that you said resonate with me. It was a really big deal. My practice will be 8 years old in March. And when I decided to take a leap of faith and jump off that cliff 8 years ago, functional medicine really was considered voodoo. You know, if you Googled functional medicine, there still is a Wikipedia page that says that it's voodoo and absolute quackery medicine. And I had that sit very heavy on my soul for a very long time as I was in that mental transition space. And then, just like you mentioned, I had that patient encounter. She was the last patient in clinic that day, and she was a 16-year-old female. And I sat on my rolly stool and went up to her and said, tell me what's going on. And she said that I was just diagnosed with lupus, and I need you to explain to me how my diet and my nutrition affects my disease. And
Mhm,
honest to God, I thought I was going to fall off my rolly stool. It was like a thunderbolt came through me,
mhm.
and I threw my hands up and I looked towards the heavens and I just said out loud, okay, I'm receiving the message loud and clear. I
Yeah.
hear, I see, and I'm going to follow through. And that really was the pivotal point for me that pushed me over the edge to say, I'm going to take what very well may be the biggest risk of my life in opening up
Mhm.
a functional practice.
Yeah.
That's how Whisper Health was born.
Yeah, you listen to the whisper, right?
I listened to the whisper.
I feel like that is so many times in our careers where I truly believe that things are presented to us, that that's the path we're supposed to go down. We either listen to it or we don't. And sometimes it's hard to take that leap of faith, and you did it.
Didn't make it any less scary, right? When we hear those
Mhm.
whispers, and our body is the
Yeah.
same way. They whisper to us, they speak to us, and if we don't pay any attention to them, then they start yelling. And if we don't pay attention to that, then the body starts screaming, and that's when all hell breaks loose. But yeah, it was a really big deal for me to lean in and decide I really want to do this. And this is exactly why I was put on this planet. I was put on this planet to be a little bit of a shaker and a mover and a disruptor, and to
Mhm.
gonna follow my heart and do what really feels right in my body. And I am so grateful that I did.
Yeah. So, with people who may be listening to this podcast for tips that are going to help their skin, how do you usually shape a normal visit if somebody's just coming in and saying, "Hey, I'm in here because I want to know a healthy skin routine"? How do you talk about the holistic approach to that?
I love that question. So, I just kind of engage in a dynamic conversation. People have an opportunity multiple times a day to either promote their health or not promote their health. Like, let's make it black and white and very simple. And the way that we have that opportunity come, in our everyday life is what we put on the end of our fork. So nutrition and what we put into our body through food is you making a choice day over day over day on how you're going to fuel your cells. And that is either, the food that you put in your mouth and in your body is either whole nutrient dense foods or it's processed and it has preservatives and
Mm.
dyes and all the crap in it. It comes in a box or a bag or a clamshell. Nutrition is a really great way to start being more mindful of how to have great skin. And often people give me the deer in the headlights look, like, what? I never thought of it that way.
One thing I carried over from rheumatology to dermatology because of all the inflammatory conditions was Dr. Wheel's anti-inflammatory diet. Have you ever seen that? And what do you think of that?
Absolutely. I have an entire shelf on my bookshelf behind me dedicated to, recipe books and people writing about nutrition and how food is either, just like you said, it's either anti-inflammatory, whole nutrient dense food, or it's processed, and that is going to be promoting inflammation in the body. So Dr. Andrew Weil, again, a pioneer in this field, right? He went out and made a name and created a course and really is one of the leaders. We stand on his shoulders. He's one of the people pioneering this movement. But I think he exactly hits the nail right on the head.
So I see in my own son and wanting this holistic approach as well. And he's really been talking to me a lot also about microplastics and all these things that we eat off of plastics. I had to get rid of my plastic cutting boards, all my plastic, cooking utensils. And so I think there's this huge awareness building around us that didn't exist even 5 years ago, I don't think. I think there were people who, microcells of people who have been looking at this, but like as a population worldwide, everybody's really waking up to the fact that we're putting things in our body that aren't supposed to be there.
Amen. I could not have said that better, and I am so grateful for you bringing that up. I wholeheartedly agree. 8 years ago when I went into this, there were little micro pockets of people that were practicing this way and had a voice regarding the pesticides, the plastics, the environmental toxicants that we're exposed to every single day. But they were few and far between, and their voices did not reach very far. And now we have people like Dr. Mark Hyman, Dr. Andrew Weil, who, these are incredibly well-known individuals who are speaking up to really gain a foothold. And it has been such an amazing experience for me personally in my practice to see the level of awareness in the general population begin to shift. I have so many people contact me via social media or email or, you know, just asking like, hey, what do you think about the environmental working group and their Think Dirty app where they're rating all the personal care products? And I'm like, amen, sister, go on it, use it, scan that barcode because it's really, really important. And everything, the bottom line is everything that we're exposed to and that we intake in the form of food and water, everything, the toxins are cumulative and we need to do something to be offloading that and lowering our bucket every single day as much as possible so that the bucket doesn't overflow and have bad things happen, right?
So yeah, we talked about what we're putting in our body, but then you're also saying also what we put on our body and what gets absorbed through it. And then on the flip side in derm, though, we know that Sometimes we see contact allergens to natural things too. So how do we find this balance between, okay, you're going to have an allergic reaction to potentially putting all natural on your body just as easily as something maybe that was made in a lab. So how do you balance that talk on, let's use something, what kind of ingredients do you prefer people avoid topically on their skin?
Yeah, that is a really interesting conversation because you're 100% correct. People can react to natural ingredients just like they can to anything synthetic. And I always kind of come back to the patient and say, you personally are an N of one experiment, right? Because
Mhm.
your genetics and your exposures and the way that your body is, liver is processing things, the way you're methylating, glucuronidating, acetylating, like that's how your liver processes all of the things that it has to process to be able to excrete and detoxify. So everybody has their own genetic fingerprint, unique fingerprint. They all have their own unique exposures. They have their own unique in utero experience and exposures.
Mhm.
So you're your own end of one experiment, and you're going to have to try things and see how you do with them. As far as products that I like to recommend, I really do lean very heavy on that environmental working group app where you can download the app on your phone and you can scan a barcode. And if you're shopping in Walmart or CVS or Walgreens or anywhere, you can scan that barcode and it's going to give you a rating of how clean that product is. So
Mhm.
I always like to recommend things that are as clean as possible. The less ingredients, the better. But the potential for having a reaction or an allergic contact dermatitis is always present.
Right. Literally anything we put on our skin. I tell people all the
Yes.
time, we're not really born with that. Your skin just all of a sudden decides, hey, I don't like this.
Right.
And then you got to you got to listen to your skin and say, okay, maybe I never use that ingredient again because otherwise I'm going to get a rash every time I use it. So,
Right.
yeah, it could happen literally. It could happen with something natural. It could happen with something unnatural and made in a lab. And then when it does happen, you have to listen to the whisper.
Yes.
Okay, so I think one big, huge conversation again is people are asking, what can I do healthy for my skin? And so I think in derm, a lot of it is three answers, right? Sunscreen, vitamin C, and a retinol or a retinoid. What do you think are your top things that are put in our mouth that are going to make our skin healthier?
Absolutely. So the food is really, really important. I like to recommend fiber. We are, as a society, as a general culture, are not consuming enough fiber. What is fiber? Fiber comes from plants. So that's our fruits and vegetables, right? The recommended fiber intake for an average adult, I'm recommending that somebody eats 35 grams of fiber a day. And I will tell you that the average person out on the street is probably consuming maybe 15 grams of fiber a day. So, fiber as a macronutrient is really, really important. Eat your fruits, eat your vegetables. Fiber's really, really, it does so many things. It helps your body detoxify. It helps you move through food through the gastrointestinal tract or the gut to, make sure that you have proper elimination. So, fruits and vegetables, fiber would be number one. The second thing that I think about that is the most important thing that we ingest is water. Most people are absolutely dehydrated and they have no idea that they're dehydrated. They may not feel thirsty, but on a cellular level, they absolutely are dehydrated. And our body is a photoelectric being. We are essentially batteries. And if we don't have enough charge to run those batteries, then bad things happen, right? So we need good, clean, filtered water to be able to create that charge. And in that same conversation about creating charge and promoting batteries, the other thing is not something that we ingest, but that we get on our skin, and that is natural sunshine. So I absolutely am not asking people to go out and get burned, really be
Mhm.
mindful of the very potent UVA and UVB times of the day. We don't want you to get sunburn. But you do need sunlight on your skin because that helps you make vitamin D. And vitamin D is incredibly important. Vitamin D really isn't a vitamin, it's a hormone. And it has so many jobs in the body. So I would say fiber as a food category, water, and then sunshine.
Okay. And the sunshine, we've been in derm accustomed to saying you maybe like 10 minutes without your sunscreen on. What do you usually tell people?
I double and even triple that. I want
Mhm.
people outdoors for 30 to 40 minutes every single day with as little clothing on as possible. Expose your skin to the sun. It's, again, we're not looking to get people red or burned or blistered. We're just looking for that UVA, UVB sun exposure because that is directly charging our mitochondria. And our mitochondria are the energy powerhouses of our cell, which help create those batteries. Those are our fuel sources. And we are light beings. We are driven by a circadian rhythm. And I push people to get out from indoors. We do not want to be under fluorescent or LED lights. We need to be outdoors and getting natural sunlight on our skin.
So, whole new part of non medicine in helping our bodies feel better and act better. Do you recommend stuff like acupuncture and using our platelet rich plasmas and stuff like that? More of a holistic approach to interventions for the body, like platelet rich plasma for even filler, some people are, or hair regeneration. What do you think about all of that?
Love that. And I absolutely do personally recommend acupuncture all the time. Chinese medicine has been around for centuries, and, those practitioners really, they know what they're doing. So I refer out to acupuncture very, very frequently. And I did platelet rich plasma for skin rejuvenation in my dermatology practice. And now they are using it for hair regeneration. I
Mhm.
absolutely love that. I think there is a place for all of that.
Are you still working in dermatology part time?
So I was up until December of 2025. I stepped away. So now I am full time in my functional medicine practice, and we have a general functional medicine practice. So I treat pretty much everything. And over the last 18 months, I have been kind of shifting and having my niche or my specialty be dermatology. So I'm really pushing that and just like you, really just trying to educate people, any parents, children or adults that deal with chronic skin conditions like eczema, psoriasis, acne, rosacea,
Mhm.
vitiligo, alopecia areata, any of those chronic stable skin conditions. If you feel like you're not getting the answers from your dermatology professional that you are looking for, I just like to really encourage people to continue the search. Keep looking for, the provider that is going to hear your concern and be able to answer your question. Back almost 8 years ago now, when I sat in front of that 16-year-old young adult who asked me, Kerry, how does my diet affect my skin disease? I was very transparent with that young
Mhm.
lady. And I said, I don't know how your diet affects lupus, but I will tell you that I am willing to go on this journey with you. And I'm willing to learn, and we can figure this out together. So, if somebody is looking for a more natural or holistic approach to treating a chronic skin condition and you feel like the practitioner that you're working with is not able to either answer you or is kind of brushing you off and gaslighting you and making you feel like you're asking a silly question, I encourage people to just continue the search. There are
Mhm.
practitioners like us out there who are doing this type of work. And, there is a way to heal chronic skin conditions. We do it differently. And for the right type of person, this type of treatment is not an instant fix. It takes time. And I'm very transparent with my people prior to them signing on with our practice. It's not like a light switch. It's not like you're going to flick a switch. It's not like
Mhm.
giving prednisone where all of a sudden the symptoms are going to go away because you're suppressing that immune system. We are going to rebuild your body on a cellular level, and that takes time. So you're going to
Yeah.
have to be patient and allow the process to happen. But again, I just like to educate people, if you're looking for a different alternative type of practitioner, don't give up that search.
Do you encourage people to continue what they've been prescribed while they're going through that process of rebuilding with you?
Yeah, it depends. It depends. Every patient case is unique, so it depends on what we're dealing with and where we are in their process. I'm definitely not anti-medication. I'm not
Mhm.
anti-pharmaceutical. I'm not anti-vax. I'm not anti-medication. sit on a fence and I try to balance. There's a risk versus a benefit to everything that we do. So we have open
Absolutely.
conversations, and the patient is always the person that makes the decision. I'm not a dictator. I'm here to educate you and empower you to make your own decisions. So if we have a really severe case of eczema, say in a young child, and the young child has a severe flare, I'm going to tell that mama to put a cortisone ointment on that child. Let's get that flare down. Let's calm the immune system while we continue to do the work that is going to
Right.
make the long-term change.
I love
Yeah.
that you had happened into dermatology and then really found your passion. And then I love that you were able to make that leap and jump into now this year just solely owning your own practice and seeing this through with your patients. And I think that's really incredible. At the end of this, we'll include the link for being able to look at products and make sure what you're putting on your skin is healthy. Can you remind me the name of that again?
Link, it's an app and it's called Think Dirty. And the Think Dirty app is put out by the Environmental Working Group, who is a nonprofit organization, and they have a tremendous database of chemicals and ingredient lists. So if you are shopping in any store and you pick up a product that has a barcode, you're able to scan the barcode with the app and use the camera on your phone. And it's going to give you a rating on how safe that product is by the chemicals that are listed on that, ingredient list. They give it a scale on a range of 1 to 10. And if it's from 7, 8, 9, it's red. If it's 4, 5, 6, it's yellow. If it's 1, 2, 3, it's green. So you always want to look for the green to yellow colored products because they have less ingredients, and the ingredients that are in that product are a little bit more safer rated for application to your skin. So again, it's the Think Dirty app by the Environmental Working Group.
Anything you can just pick up and scan, that makes it super easy. And the other thing I was going to say
Yep.
is you're in Florida, right?
Absolutely. So I am physically located in Florida, and I am licensed in the state of Florida and in the state of Georgia. So anybody that is interested in potentially looking into our practice, if you live in Florida or Georgia, we can absolutely work together. My website and my practice name is Whisper Health, and the website is www.whisper-health.com. And we have a generalized functional medicine practice where we treat autoimmune conditions, long COVID, mold and mycotoxin illness, vector-borne diseases like Lyme. So we treat everything, and we do have a specialty in dermatology. So anybody that has any type of chronic skin condition and they're looking for more of a natural approach to heal their skin, we heal skin from the inside out without the use of harsh medication.
This has been amazing. I would love to learn more from you. I think that this is the direction that a lot of our patients are moving. They want this more holistic approach, and they want to understand how their body is influencing the way that their skin is acting. I love that you
Yeah.
were willing to come on and be one of my first guests on Derm Clarity today.
Thank you so much, Erica. It was a pleasure to be featured as one of your first podcast guests, and I look forward to collaborating with you in the future.
This has been Derm Clarity, poor decisions and flake news, real dermatology, real science, and real conversations. Remember, your skin is telling you a story. Listen to it, ask questions, and don't settle for flake news.